Hello and welcome to my channel. This is Isaac Simple and Real. Thank you for tuning to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe to my channel. Like and share. Thank you. This is a channel that we usually talk about issues concerning averting HIV stigma and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Kindly, let's continue empowering our community of being responsible of their own health so that we can be able to avert the issue of stigma in our society. Let's all engage. Thank you. In our topic today, we are going to discuss about genital herpes. Someone may ask, what is genital herpes? Karibu sana. Now, genital herpes is a sexually transmitted infection that is usually caused by an enveloped double-stranded DNA virus that we usually call herpes simplex virus. Now, herpes simplex virus usually presents itself in two subtypes. We have herpes simplex virus type 1 that has an oral predominance or usually present most of its symptoms in the mouth. Then we have a herpes simplex virus type 2, which usually has a genital predominance or usually appears on the genitalia. However, these two subtypes of viruses can present interchangeably. That means you can have herpes simplex virus type 1 in the genitalia. You can also be able to find herpes simplex virus type 2 in the mouth or in the oral area. That is where usually we have the predominance of type 1. Thank you. Now, what's the mode of transmission of genital herpes? This kind of infection is usually transmitted via skin contact. Skin contact may happen either perinatally, that is a transmission during delivery. It can also happen via coital or during sexual intercourse, or via general skin contact. When you touch someone or oral or vaginal secretions of someone who is suffering from genital herpes, you are prone to having genital herpes infection. Or you can be transmitted the virus of herpes simplex virus. Are we together up to that point? Thank you. Now, how about the presentation of someone who is suffering from genital herpes? Let's start with oral presentation. Like any other virus, they usually present with flu-like symptoms. That is, sore throat, may present with cold sores. We also call it angular stomatitis or blister-like lesions that usually appear on the angle of the mouth. They usually disappear between 1 week and 1 month of presentation. Then patient may also present with rashes on the tongue, on the roof of the mouth, sore throat, tonsillitis, and pharyngitis. Other presentations include headache, dizziness, hotness of body. Are we together up to that point? Thank you. Now, let's go to other presentation of genitalia or genital presentation. Someone who is having genital herpes will usually present with blister-like lesions or rashes, mostly for the moist areas. Moist areas include labia majora, labia minora, vagina, introitus, the anus or anal folds, rectum. These areas usually present with blister-like lesions that are painful. For the ladies or female may also present with pain while passing urine, or they may also present with dyspareunia or pain while having sex, may also present with vaginal discharges. So those are other symptoms that someone who is having genital herpes may also present. We have talked about blisters. For the dry skin areas, that is the likes of buttocks, the likes of prepuce for the uncircumcised male, the likes of glans penis for the circumcised males, the shaft of penis, and the scrotum usually presents as pustules that usually bursts, and then they form crusted lesions that are painful. Are we together up to that point? Thank you. Those are just basic presentation of someone who is having genital herpes. In my presentation, I will also include pictures that you will see as we continue learning. Thank you. Now, how do we make the diagnosis of genital herpes? Someone who is suffering from genital herpes, the diagnosis in any healthcare facility is usually clinical. However, to confirm the diagnosis in more equipped, especially research laboratories, we usually use two modalities. One of them is culture test, which is not very effective in the diagnosis. The best or the diagnostic modality of choice is usually the PCR, or we also call it polymerase chain reaction test. This is the confirmed diagnostic modality that is usually approved as the best. Now, let's go to the treatment. For the treatment, we usually say that genital herpes has no cure. However, we can be able to reduce the number of viruses of herpes simplex virus in your body or in your blood by using kind of treatment that we call nucleoside analogs treatment. These drugs include the likes of valacyclovir, ganciclovir, vanciclovir, and the likes of acyclovir and famciclovir. These are drugs that are usually available in our healthcare facilities, and we can be able to use any of them in the treatment of genital herpes to reduce the symptoms or to make your life more comfortable and to reduce the number of viruses in your body. Are we together up to that point? Thank you for following this closely. Let's now go to the prevention. We should say that prevention is better than cure. Now, in this case, if you have multiple number of sexual partners, it's the highest time that you reduce the number of sexual partners, because this is the only modality that we can be able to prevent you from getting this kind of virus. This is because by use of condom, you will, or any other barrier method using coitus, you are not able to prevent this kind of viral infection, because we said that it can be transmitted via oral sex, via anal sex. It can also be transmitted via skin contact. So you see, at this point, a condom may not be the preventive measure of choice, or the best preventive measure of choice. Are we together up to this point? Thank you. So kindly, if you have multiple sexual partners, is the highest time of risk reduction. And this comes to the end of our topic today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is Isaac, simple and real, Mkurugenzi Maish, or you can also call Puma Health Solutions. Thank you, and God bless you. Kindly subscribe. This is Kenya Health Talk. Bye-bye.